Okay, I'm going to talk about a bit of hand anatomy now. So essentially, we're going to talk about a bit of finger yoga and some stretching. The things you need to know are that these are the metacarpals, and these muscles in here are called the intrinsic muscles of the hand. The extrinsic muscles are up in your forearm. And the intrinsic muscles, there's lots of different types of intrinsic muscles. They have the job of spreading your fingers apart, making a wide span. See these muscles here and here and here and here are all contracting to spread your fingers apart. And they also bring your fingers, different ones, bring your fingers together. They're called the interosseous muscles because they're in between the bones, in between the metacarpals here. Then you've got your phalanges, proximal phalanx, middle phalanx and distal phalanx. And then these joints are called the metacarpophalangeal joints, the MCP joints. And these joints here are called the proximal interphalangeal joints. And these are the distal interphalangeal joints. So these are the interphalangeal joints and these are the proximal and distal ones. Proximal, distal. And as you can see, you can flex your MCP joints and keep your interphalangeal joints extended, and you can flex your interphalangeal joints and extend your MCP joints. Now, what makes that happen? Well, you've got your long extrinsic extensors up here, and you've got your long extrinsic flexors along here. And when the flexors contract on their own, they do that. And when the extensors contract on their own, they bring your MCP joints up, and they need a bit of help to bring the interphalangeal joints up. They do that with the use of intrinsic muscles in the hand, because the intrinsic muscles are essentially there just to make the interphalangeal joints extend. So I can draw now how the intrinsic muscles work. Essentially, they're very complicated. You've got a metacarpal head here with its center of rotation like that. And you've got your proximal phalanx like this with its center of rotation here. You've got your middle phalanx here with its center of rotation just here. You've got your distal phalanx down here. Like that. And your intrinsic muscles, as well as doing this and that, have this further complicated role because they generally sit on the palm side of these joints like this. The muscles are down here, and then the tendon comes up along the side like that, and then goes along the back of the finger down into the extensor tendon. Because it does that, its tendon comes along here like this, and it goes on the back, on the extensor side of the axis of rotation of these joints here. So you can see as it contracts, it tends to bend this joint and extend these joints. That's how the intrinsics work. If you want to stretch an intrinsic muscle, you have to do this. You basically stretch it around these joints here and here, and you stretch it against here. When you get to this point, you should be able to get the pulp of this finger to touch the soft fleshy part here, with this joint contracting to about 90 degrees and this one to about 100. If you can't do that, then your intrinsics are tight. That means they've been working very hard and they haven't ever been stretched properly, so they need to be stretched out. And to do a further stretch, you can do this. you can stretch it around this joint here. So that's a full-on intrinsic stretch. And if I do that in all my fingers, I can feel that some of them are pretty tight. You can see the fingers blanching. You can see how hard I'm working on that to get that to do that. And this is an active stretch, and this is a passive stretch. If you do that, you can get a little bit more out of it. You can do that on each of the joints like this, like that, and like that. So I find that a very useful stretch for patients who've got tight intrinsics, and that may be the cause of quite a lot of problems. It might even be related to trigger finger in musicians. And stretching your intrinsics is certainly a good way of improving the imbalance that happens in many musicians' hands who work their intrinsics really hard and don't ever stretch them, because it's not a natural thing to do, to stretch it that much and that posture. And then of course you can go through your other exercises. You can do an intrinsic contracture, and then you go back to this position again. So shorten your intrinsics and stretch your intrinsics. That's how that works.